Hey there, so this video is going to address section 2 of the alternative topics book, section 2 of the alternative topics book. And there are 3 readings within section 2. The first one is on the use of complementary and alternative medication for individuals who have been diagnosed with cancer. The second is on kind of the social spread of complementary and alternative medication amongst yoga participants. And then the third is on essential oils, and I included that because that's going to be the one article that all of you are going to read. So, because if I were a college student right now, I'd be like, oh, I want to read this one. This is really cool. So, but the bottom line is when you start kind of going through these and you know start asking yourself, well, what's the point of this? Why am I reading these things? So here's the deal. So we currently survive here in the U.S. in kind of a Western medicine, allopathic medicine type of framework. I mean, that's what we do. And there's this thing that floats around out there referred to as best practices. And physicians, when they treat you, when they offer you a remedy, when they're trying to cure you, they are going to default to this idea of best practices. Best practices focuses on what's going on in this actual published scientific literature. And therefore then, if they follow that particular rigor based on science, then if anything goes wrong, they can certainly fall back on, well, look, I followed what these particular articles said. In other words, you have this particular ailment, so I'm going to treat you with X, Y, and Z based on the established science. And therefore then it releases the physicians and healthcare providers from any type of litigation. I mean, flat out, it's kind of a protective mechanism. Now, that being said, I don't know why you wouldn't want to follow what the science said anyway, especially if something's been shown to be effective and it works. And the other thing is, when things have been addressed by science, medicine has been addressed by science, you actually get a lot of information about side effects and things that can go wrong and what to look out for, et cetera. So there's a lot to be said about Western medicine and allopathic medicine. All right, so totally. Complementary and alternative medicine, however, has not been tested as fully, and we're getting better over the last 5, 10 years, 15, 20 years on testing certain remedies out there. But still, there's a lot of a blank slate. Like, we just do not know what some side effects are. The general rule of thumb is, well, it's natural, so it can't hurt you, and that isn't necessarily going to be the case 100% of the time. I put a story in there about Steve Jobs and his ailment. And there he went ahead and addressed and actually utilized complementary alternative medicine to try to heal himself. And then by the time he kind of his doctors discovered that that really wasn't working. And as a patient, it's your right. You can do anything you want. So at some point, his cancer continued to grow, and then he finally turned to Western medicine for treatment, but by then it was kind of too late. So here, even though the treatment he was using itself, the complementary alternative medication, wasn't directly hurting him by actually essentially taking some type of complementary alternative medication as a treatment and then having it not work at all, that's where it can actually hurt. Do you kind of get what I'm saying here? In other words, if you just solely rely on these unproven remedies, you can actually do harm to yourself because they may not work. All right, and so certainly, and in addition, these things can have some side effects that we're not aware of, et cetera. So it's kind of that's what I'm saying. It's a kind of a blank slate. So I do want you to kind of be aware that these complementary alternative medications, they're out there, but many of them aren't proven. Many of them we don't know what the side effects are, and that there are downsides to them. There can be, including them not working, and which can be a problem, especially if you have a serious ailment like Steve Jobs did. Now then, the other thing, though, why do some people turn toward complementary alternative medications? Well, if there are no available treatments out there. Okay, so and that's important to realize. Look, for instance, with COVID-19, people were scrambling to try all sorts of different things, and still as of what we're in mid-October now, you still have people kind of running around trying some alternative medications, and why is this? Because there's nothing available. And the article on cancer treatment kind of underscores that. Look, if there are not available cancer treatments, you're going to turn towards something, because some individuals are just going to be like, look, I can't just sit idly and let something kill me. I need to do something. I point out in a little introduction with the early years of HIV/AIDS, where there were no treatments available for years, like 3, 4, 5 years, and so a lot of individuals traveled to different countries to try different treatments, very similar to what you're going to read about in the cancer article. And because there's nothing out there, so you have that going on too. Now, the last thing I'll leave you with is also, why can't we just try more complementary alternative medications? And something I point out is that, well, if you have physicians and healthcare providers and you have insurance companies basically making money off of typical Western or and allopathic treatments, they're not going to want to allow new treatments to come in. All right, so and not only that, but look, if you're paying a lot of money for this particular drug, why would you want to allow even funded research to try this other thing that might be natural, that is way less expensive? Why would you want to let that into the system, especially if you know that these particular medications do work? And so I point that out too, where it's kind of like, there's physicians and insurance companies are kind of gatekeepers for what gets into the system and what doesn't get into the system. And so that actually keeps some complementary alternative medications out of our reach in terms of use. So anyway, lots of pros, lots of cons here, and that's what I want to underscore too. It's like, if you're going to utilize complementary alternative medications, go into it with your eyes wide open. Realize that a lot of these things are unproven. Realize that they may have consequences if that's the only thing you use. Realize that that when you go see your healthcare provider and they do provide you with these particular drugs, that's going to be based on best practices. And you're certainly free to ask questions. Well, what about this natural remedy? Can I try that too? And a lot of times the physicians will be like, yeah, sure, you can do this. It probably won't hurt. So there you go. So go ahead and work with this a little bit. Read it through, see how it resonates with you here in section 2, and enjoy the essential oils article. Again, probably the only one you may read. Okay, all right, thanks.